the changing healthcare landscape. The wonderful panelists for today, I welcome Dr. Nehal Shah sir, Dr. Bhavna Gadvi ma'am, Dr. Dhara Shah ma'am, Dr. Swarna Garveer ma'am, Dr. Meeta Saxena ma'am, Dr. Megha Seth ma'am, and our wonderful moderator for today, Dr. Alpa Purohit ma'am. I would take the privilege to introduce Dr. Alpa Purohit ma'am. She has done her master's in orthopedics and PhD, currently serving as a principal at AIMS Physiotherapy College, Ahmedabad, with an impressive 18 years of experience and 15 years of postgraduate guide. She has mentored numerous budding physiotherapists and contributed significantly to the academic excellence. Ma'am has presented over 15 research papers at various national and international journals and conferences. She has been actively involved in the scholarly publications. She has delivered multiple expert talks across the conferences, sharing her wonderful knowledge and clinical insight with wider physiotherapy committees. Her contributions have been reflected at various awards at the conferences. And in addition to everything, her academic and clinical role, she is also serving as a state sub-coordinator in IAP Women's Cell, contributing towards the achievement and wonderful practices. Thank you so much, ma'am. So over to you, ma'am.
Thank you, Aisha ma'am. Good afternoon, all respected panelists, respected faculties, and dear students. Myself, Dr. Alpa Purohit, on behalf of IAPWC Gujarat State, I welcome you all on today's panel discussion. The topic of this panel is Translational Physiotherapy, Connecting Classroom, Clinic, and Community. As we know, the Translational Physiotherapy represents an integrated approach and connects the classroom, theoretical knowledge, clinical expertise, and community-based care to improve patients' outcome and professional development. It focuses on accelerating the bench to bedside process, ensuring that research evidence and academic learning are effectively implemented into a real-world setting. I am not only into having a more evidence to justify this topic. So I heartily welcome our first speaker. Next slide, Dr. Nehal Shah sir. Alope ma'am, slide next. So we are having a very expert panelist, Dr. Nehal Shah sir. He is the MPT Ortho and working as a chairperson, Gujarat State Allied Healthcare Council since December 24. Based clinical practitioner in the Ahmedabad. He has as an executive committee member in IAP Ahmedabad since 2002 and also editor in 44th National Conference of IAP 2006 held in Ahmedabad and also worked as a treasurer and convener in IAP Ahmedabad. He has done a multiple CME, workshop and seminar to uplift our profession. He has done a meeting with the Ministry of Health, Gujarat State, for getting a Gujarat State Physiotherapy Council bill passed in Gujarat Assembly in February 2011. Thus, Gujarat was fourth state to have an independent state physiotherapy council. Welcome you, sir. So now our next speaker, Dr. Meeta Saxena ma'am. She is a based clinician in the Baroda. She is running her own physiotherapy clinic since 1991 and senior consultant and head physiotherapy department, KG Patel Children and Women Hospital, Baroda since 1987, where she oversees the pediatrics and adult OPD and the NICU and PICU. She is having a more than 35 plus years of experience and also awarded the Physio Ratna by the IAP at the Gujarat State Conference in May 2019. She was awarded for the meritorious service for outstanding contribution to the therapy profession by Dr. Brian Mulligan at the CMP International Conference 2014. She has published or presented 12 research papers at national conferences, of which 2 have won this award. She is a resource person of Handicap International since 2006 for training of physiotherapists at Kabul, Afghanistan, and asset. Welcome you, ma'am. Our next panelist, Dr. Swarna Garveer, ma'am. She is working as a vice principal professor of the department of therapy, DVVPF College of Physiotherapy, Ahalyanagar, MUHS, India. If I'm talking about her achievement, she was as the Best Teacher Award by MUHS in 2024. She is a member, Primary Care Group, World Rehabilitation Alliance, IFNR representative. She is working as the academic excellence. She has awarded as the Academic Excellence Award from IAP in 2025. She has published more than 150 research papers in national international journals and also authored in 5 different books. Currently, she is working as a Maharashtra State Coordinator in IAPWC. Welcome you, ma'am. Our next speaker, Dr. Megha Sheth, ma'am. She is working as a lecturer in the SBB Physiotherapy College since 2002. She is having a more than 24 years of experience, and she is currently postgraduate and PhD guide in Gujarat University. If talking about her achievements, over 180 publications in national and international journals. She has written 6 books as a co-editor published by JP, Principles and Practice of Physical Rehabilitation, Physiotherapy in Various Musculoskeletal, Biopathy, Medical and Surgical, Neurological, and Women's Health. She has received the prestigious Fellowship Award at IAP Conference, represented India at IPTOP, International Association of Physiotherapists Working for Older People, a subgroup of World Physiotherapy. Welcome.
Thank you, Alpha ma'am and IAPWC.
Bhavna Gadvi, ma'am. She is currently working as a Dean, Principal, and Faculty of Physiotherapy, Parul University, Vadodara. She is PG Guide since 2011 and PhD Guide at Parul University since 2021. She has an experience of more than 30 plus years in the field of physiotherapy. Out of that, 23 years academic experience. If I am talking about her achievements, she has published in more than 25 publications in national as well as international journals. She has also contributed as a many author in 2 different books. She has delivered more than 50 talks at different state and national conferences and radio and television platforms. She has been awarded as a Best Principal Award in 68th National Conference of IAP 2023. She has also served as a Gujarat State Head at IAP Women's Cell from 2020 to 2024. Currently, she is a member of governing body of SIP. I would like to add one more line. Under her guidance and leadership, I have started my journey in the IAPWC Gujarat State. Thank you, ma'am, for your valuable guidance and support always. Welcome, ma'am.
It's always pleasure to be here on the platform of IEP Women's Cell. It is like a home, coming back to home again.
Our next speaker, Dr. Dhara Sharma, ma'am. Currently, she is working as a founder in Medusa Institute. She is having a more than 20 plus years of experience in academic and clinical experience in the neuro rehabilitation and physiotherapy education. If I am talking about her achievement, she is working as a panelist in different national as well as international conferences. She has published many research papers in national as well as international journals. She was former dean in health science, Silver Rock University. She was worked as a author as well as co-editor in different books. She is a pioneer in the neuroplasticity-based rehabilitation, championing cortical engagement and active recovery over passive interventions for superior patient outcome. Welcome you, ma'am.
Thank you so much.
So now, moving ahead with our panel discussion. So I would like to begin with first panelist, Dr. Nehal Shah, sir. As you are managing a department in our council as a chairperson, where our curriculum has been designed and approved and implemented. So I would like to ask a first question to you, sir. The question is like that: what structural or policy level changes are essential to bridge education and clinical practice? Over to you, sir.
Am I audible?
Yes, sir.
So, good afternoon, one and all. See, basically, it is kind of bridging the gaps, synapse So between educational and clinical practice, it should be, what I see is it should be beyond the clinical hours, and it should start. See, Gujarat is having very good. So far, my knowledge is that Gujarat has a very good plan for the students for who are interested in going for clinical practice. They are being very well. Given observational posting since second year. So it is quite well organized structure over here. Same way, there should be in structural changes first that I say, that is instead of just moving them from one to another OPD by month to month, it should be on rotating system with the same like in as in internship. So other than the OPD, they should be in multi-unit groups, somewhere in adult acute care or pediatric care or ICU or any specialty or something like that. And even along with that, there should be early clinical immersion. Right. So from first year itself, they should be given proper observational posting at least once or twice in a week for 1 to 2 hours, and they should be given proper atmosphere regarding the instrument and how the clinic works, how they are going to be in future. Right. Along with that, once the student comes into third or fourth year, there should be certain joint appointments, right? I know that all the colleges are giving case presentation and all, but many a times improper assessment are also there. So there should be joint appointments where the clinician or the senior lecturer or the clinical therapist of that particular college, they should be examining the patient along with that particular student, and likewise joint appointments will also give very good clinical expertise to the students, because I feel there is many a times what the student sees is what his teacher has followed. It is like गुरु शिष्य परंपरा, उसने ऐसा किया तो मैं भी यही करूंगा, उससे आगे नहीं जाएगा. Many times these kind of things follows. So these are the basic things, and so far we have seen that there are very nice simulation labs. So that thing is also very much important. Okay, once he or she, the student, moves to private practice or he is going to see the live patient, there should be AI based or something like models or other colleagues or likewise, that should be that that is more important, that he will be mastering that particular decision making things. Right. Uh, One more thing is policy make level changes are also important in making standardizing excellence. So uh, there is one thing what I have mentioned, right? I am going to mention, that is there should be proper formalized memorandum of understanding with the postings where the college and hospital or college and clinics they must have proper MOUs, that they have to have proper defined goals, that what they actually want from the clinics or hospitals, and how they are going to do definitely sharing of the resources and everything. Right. Then one more thing is what that is interprofessional education. So in that policy should require students from different disciplines, like not only physiotherapy, from other also nursing, medicine, pharmacy, and they are going to learn from each other in clinical setting. Right. And there is one more thing what I always wish it should be, that each and every college or institute should call at least once a month or so, that a ideal a clinician should be there as a lecturer कि in a particular subject के भाई suppose example मान लो कि कोई low back है तो low back एक how a clinician treats in different angle. कोई न्यूरो केस है तो how a clinician treats. Definitely the student is being taught, but when he or she is entering into private practice तो वहाँ पे there is much more difference कि भाई assessment से लेके सब कुछ अलग अलग जाता है. The assessment what the student is being taught is in third year that takes around maybe 1 hour or 2 hour. So वो private practice में it is not quite compatible for this kind of assessment. So how that clinician treats this kind of patient, दैट शुड बी मोर इम्पोर्टेंट कि भाई महीने में एक बार 2 और 3 आवर्स का एक क्लिनिकल सेशन रखो कि जो कोई एक पर्टिकुलर केस में ही जाए. डेफिनेटली आप लोग केस प्रेजेंटेशन करते हैं सब कुछ करते हैं बट दिस इज व्हाट आई फील दैट इज आइडियल ब्रिज कि दैट मेक्स क्लिनिश future clinicians more better. So that's all. I guess this is enough from my side for this question.
Yes, thank you so much, sir, for nicely explain about the bridge education and clinical practice. And you have given your valuable one word, that is the policy making, standardization with excellence, and importance
Yes.
of minutes of meeting, which is very helpful for the students whenever they are going for the clinical practice. Thank you, sir.
Right. Yes. Thank you.
So my next question is to Bhavna ma'am. My question is, how can the institution develop a strong clinical reasoning skill? Over to you, ma'am.
Okay. First of all, thank you for this opportunity to share my experience view here. So, if we consider the clinical exposure into academics, then everything is structured given on paper. We also teach these things into classroom, but there is a huge gap between what is being taught into the classroom and what is being implemented into the clinical practice. Now, as we are heading towards the implementation of curriculum given by NCHC, there has been written a very clear-cut instructions and the format how we can execute the clinical practice so that the clinical exposure as well as clinical skills are developed. So there is again two terms it has to be mapped at each and individual university or in institution. That is how knowledge is imparted, how skill has been developed, and how knowledge and skill are integrated to teach or to treat the patient. So that is very important aspect of a teacher or a teaching institution to comply while we are delivering. There is a format of, like, for example, we have a structured clinical exposure given to each and every student starting from second year till the final year and during internship. Now, as we have NCSP who has very clear cut defined how to give exposure, clinical exposure to the students. So there are three steps they have given. First step is observation, where the student observe the patient is being treated into the clinical practice. And second one is performed under supervision. So, for example, if the students are observing from second years, then in third year they are performing some exercise therapy techniques or some electrotherapy modalities are being given under the supervision of the higher level. And the third one is perform independently. So every student has to be given all this exposure throughout their teaching duration, and that is where the responsibility comes on the teaching institution to provide a good clinical exposure to every student, not just to go and observe, but they should have that opportunity to perform under the supervision of a skilled teachers or a therapist and to perform independently where they have at least exposure of individual student has to perform it individually student has to treat individual patient as a whole. So on theory basis on paper it has been given, a structured thing is being given. Like for example, OSCEs are available for every level of education in physiotherapy. But how many institutions are actually implementing it? And I think the the query, or maybe the loophole, maybe the uniformity, which now we have overcome, and now we are really into the phase where every institution would execute in a same way, and that is why the clinical criteria for like allowing an educational institution to have a 300 minimum bedded in hospital is needed, where all the specialized departments should have. So all the students should have hands-on practices during their clinical tenure and during internship. So I again appreciate the work of NCHC, who has given 1 year of internship, which is a very prestigious duration where students perform independently, so that after their bachelor degree or master degree, they can actually give the treatment in a proper format. And as now we are into competency based education, not just show, but show how is very important into the practical concepts. So show how should be always evaluated on the patient. So OSPI and OSPI should be the key aspects of any clinic, any evaluation system in education. Again, that was all quantitative. Now talking about the qualitative things is clinical reasoning, evidence-based practices, or simulation-based case discussions. This has to be practiced everywhere. This has been practiced everywhere, I think, to a larger or to a smaller extent, but it has been practiced. Continuous upgradation of faculty is also needed for such competency-based education, where teachers are skilled enough to teach to students. So these are my observation into this duration, where we can improve the clinical practices. So it's not just the student who need to get strengthened for this, but it's the teacher who needs to get strengthened for effective teaching, the learning, the strategy. Thank you so much.
Thank you, ma'am, for nicely explain about the 3 steps. That is the first, observation, perform under supervision, and third is the perform independently, which is very helpful not only for the student as well as academician. As we know, the new NCHP syllabus is coming from this year onwards, so which is going to be very helpful for all our profession. So thank you, ma'am, for your explanation. So my next question is to Sumarna, ma'am. How to translate a complex clinical knowledge into a functional outcome. Over to you, ma'am.
Yeah. Thank you, Dr. Alpa. I hope I'm audible. And thank you so
Yes,
much for
ma'am.
inviting me as a panelist here. And I thank IIPWC for the same, IIPWC Gujarat team. Very rightly said by Bhavna Madam that clinical aspects are very, very important as far as our students are concerned. And the correlation between the complex clinical knowledge with that of functional outcomes is something which is a challenge for a teacher to make the student to understand. Because when students are treating the patients or assessing the patients in the clinic, they are in their own world and they are thinking in terms of more of range of motion, the muscle strength, the balance. But they are not, listening to the patient. That patient says that, I have a problem in squatting down. I have a problem in climbing the stairs. So I think the students needs to understand the patient's language in a much more better way, so that the functional outcomes can be improved. So student is more of thinking in terms of improving the range of motion or improving the muscle strength, whereas the patient is more concerned with ability to conduct, ability to perform a task. So I think here the role of ICF is very, very important. That is International Classification of Functioning, which has there in the curriculum of most of the physiotherapy institutes or universities. We as a faculty needs to make the students understand that it is the patient's expectations which are also equally important as our clinical assessment and our clinical improvement is concerned. So I think the goal setting is something which we need to make the students understand that the patient has to be an important component. The patient's expectations has to be an important component as far as the goal setting is concerned, and that is how they will be able to convert the clinical improvement into a functional outcome if they are taking the patient into consideration. That is, what are his expectations out of the treatment. And I believe to make our intervention, make our treatment more effective, the outcome measures that we use in our day-to-day clinical work should be more of Indian aspect, Indian population related. Most of our outcome measures are probably still taken from the Western population. So probably there is something which we as a physiotherapist, have a greater scope as far as the outcome measures that we use in our day-to-day setup, wherein it needs to be modified, it needs to be converted from a Indian perspective. So I think these are 3-4 things which would make the translation of a complex clinical knowledge into an effective functional outcome as far as our patients are concerned. Thank you so much.
Thank you, ma'am, for giving us importance of which is very important during our curriculum, during daily our practice, because the functional outcome is very important. Rather than focusing only our goal setting, we have to learn something from that ICF model also, as well as we have to take care about the patient's expectation also. Thank you, ma'am. Now my next question is to Dr. Megha, ma'am. How to make a research clinically relevant? Over to you.
Thank you, Alpa ma'am, for the invitation. Thank you, IAPWC Gujarat, for allowing me this platform to talk. Thank you, Jaspreet ma'am.
Ma'am, you are muted. Ma'am, again it is mute.
Hello?
Yes. Yes, ma'am.
Okay.
Audible now.
Yes. Thank you once again for this opportunity. And continuing in the same line that Nehal sir has been saying, Bhavna ma'am and Suvarna ma'am, physiotherapy, we are academicians, but we should not forget that we are first clinicians. Even in academics, we are teaching how a student should behave in the clinics, what the person should see in the clinics. And along with that, I think now research is coming up as a very important part in physiotherapy. So our research is not lab-based, like other researches like biochemistry or biotechnology. We are doing our research in the clinical field. Our research is clinical. So we are working on patients. So it's very simple that research in physiotherapy should be applicable to patients in our clinics. Unfortunately, now we have this research being compulsory for MPT and PhD, and now students are even presenting at the third year, final year, and internship level. So how good is that quality of research, and how can they select a topic which is going to be clinically important? So research is necessary to provide answers to clinical questions more than today. It cannot be more important than today. And we should look for clinically relevant and socially important questions that can be answered with the help of our research. How can I use my research to better a patient? I need to look at gaps. I need to look at daily challenges. So like Suvarna ma'am said, that I need to go to functional outcomes rather than looking at range of motion clinically. And even in the research, I need to know what the patient wants and how can my techniques be used to improve that patient. Nowadays, even physiotherapy is expanding. The fields that we had earlier were ortho, neuro, PTMS, and rehabilitation. Now we have community health, we have non-communicable diseases which are coming into the field, and it is more because of lifestyle diseases. So how can we do research and prevent, and the role of physiotherapy in prevention of problems rather than treating of problems? We have this large increase in older people because of such good medical techniques. People are living longer, but when they live longer doesn't mean that they have quality to the years that they are living with. So how can physiotherapy help them? So these questions, if they are answered, they're going to be clinically relevant. Sports is an upcoming field. Sports was always there, but it was like cricket, hockey is there. Now there's so many varieties of sports, and we are very much into that field as well. Women were not vocal earlier. Now women's health is coming up as a very important issue. So the fields that were there in physiotherapy, clinically and in research, are getting better. In fact, the latest one now is even environment. How can our physiotherapy help save the environment with our physiotherapy techniques? So research can definitely be clinically relevant if we can find the right gap and work on it. Also, we need to, like Nehal sir said, we need to involve clinicians. Where is the gap that the clinicians find in treating their patients? And we can do research on that. We can look at patients and the patient-related outcome measures. We can also involve stakeholders, sponsors, the equipment makers, research facilitators, and we can see what they want. We can also look at socially relevant research, not only from the physiotherapy point of view, how I can get better money, but how can I improve the life overall and make India better also can be done. And the last point would be changing or shifting from getting a p-value, statistically significant research, going into finding something where the effect size is important. So research can definitely be clinically relevant. We just need to shift our vision from do whatever we were doing, but maybe look at a different perspective to this research. Thank you.
Thank you, ma'am, for nicely explain about the clinical relevance of the research. And you said that last line, rather than seeing a statistical significance, only p-value, we have to focus about the clinical significance of level on.
Yes.
Thank you, ma'am. So my next question is to Dhara Sharma, ma'am. So, ma'am, can you elaborate how the vision for making advanced physiotherapy accessible across the Gujarat? Over to you, ma'am.
Thank you very much. And thank you very much, IAPWC, for organizing this event and making me part of it. And thank you all the panelists for wonderful inputs. I am all ears and enjoying all the wonderful insights that you all are sharing. Coming back to the question, let's pause here and understand that what do we mean by advanced physiotherapy? So when I say advanced physiotherapy, the question that pops in our mind, or rather the scenario which pops in our mind is, there's robotics and there's class 4 laser and there's Tekar therapy and all advanced equipments that probably we can think of. But we need to understand that it's not the TENS machine which treats the patient, but rather the mind and the hand which operates it does. So we may have the advanced infrastructure, but the therapists who are skilled, who are competent, and who are well equipped so that they can deal completely with clinical autonomy is what we are truly looking at when I say in particular that what I mean by advanced physiotherapy. And that particular thing is what I would want to be accessible across Gujarat. So there are a couple of things that can be done for that. One of that is, first thing, again, the responsibility comes on all the academic institution which are currently having all the budding physiotherapists to ensure that, they are competent enough once they step out. And with this new curriculum and implementation, I'm sure the quality of the education, especially physiotherapy education, obviously is going to be on rise. So that would partially be taken care of. But again, that doesn't mean the responsibility of the institution any less. As Bhavna ma'am had also mentioned that, it is equal responsibility of the teacher to ensure that, the therapists are being trained at the very competent level, so that eventually we have the better quality professionals. So that is one thing. Second thing is tele-rehabilitation. So COVID proved that tele-rehabilitation works. And instead of now abandoning it, it is best that we institutionalize it, because I understand that there are certain screening or assessment that is not possible and you have to have a physical contact. But definitely that makes a burden on the the metro cities or the major cities little less, that patient can visit for the purpose of screening and assessment, and the treatment can continue in tele-rehabilitation, which will again make all the people in the rural population as well as tier 2 cities or at district level, that can be implemented. Another thing which can be even picked up by the colleges and the institution, we know that Unnat Bharat Abhiyan is what is being promoted by the government, and majority of the institutes are already adapting villages. So extending their duties for the community awareness, for serving people of those districts. Along with that, what like the institutes can do is plan the continuous educational or professional education programs, or the CPDs, what we say, that can continue in integration with all the practicing physiotherapists of those particular district. And again, the responsibility also comes on the practicing physiotherapists, that in the constant evolving profession that we are in, they also keep themselves continuously upgraded and join hands with the educational institutes, so that we can ultimately achieve this goal where the advanced physiotherapy is accessible, whether it is from Dwarka to Dakor or from Kutch to Dang. And we'll be there, I guess.
Yes, ma'am. Nicely explained about this. Clinically, it is also important to learn a new things. So it is an equal responsibility as an academician as well as clinician to learn a new techniques and learn a new advance that research, so that we can implement in our day-to-day practice and will get a good and best result for our patient. So thank you, ma'am. So now my next question is to Meeta, ma'am. So what are the challenges in implementing a evidence-based practice, ma'am? So over to you, ma'am.
Hi. So thank you, Dr. Alpa and IAPWC. Can you hear me now? You can hear me. Okay. Thank you for inviting me today as a panelist. So I think my question, I've been hearing all our distinguished speakers today, and everybody is very relevant and to the point according to their things. So I am lucky that I'm both a researcher as well as a clinician, because I run a private practice too. So I think I'm very lucky that I have a bridge between these two areas. And I think some of the challenges for that private practitioners have implementing the evidence-based practices are quite simple. I was just thinking about it, and I think that the one thing is that unlike institutions, private practitioners are a smaller body. So there may be a clinic which has maybe 2 or 3 or 4 therapists, and your patient load is more one-to-one. So naturally, these people find it difficult to go back and read and do any kind of research, and they just want to, get into a practice level only. The other so how to get these people? You have a paying patient, you have to deliver, so the staff is limited, and there is no delegation of delivering the physical therapy. Even the patient's demands are more. The other thing is that even in this day and age, first contact practice for physical therapists is still very poor, and mainly there are a lot of referrals from any field. Any of the doctors, they will send you with a big list of give IFT and US and Phalana and this and that. And so especially for the newer people, they will usually come with referrals, and it's very, unless they know and they can explain and talk to the patient and say thank you or discuss with so I think communication both with the referral doctor as well as the patient is the key. As I think one of you said, that it's so important to listen to the patient. And so I think that do not go with inappropriate forms or modalities or whatever for a patient. If you are convinced that you know that the evidence shows that this is not going to help, please talk and communicate with the referral doctor, with the patient, and say, look, I want to help you, and I think this is going to work better. So that is another way to go about. That is a challenge for most private practitioners. The third thing is the patient themselves nowadays read on Google, and they will have this and they will say, no, I read that this is going to work better and that is going to work better. So unless you have your evidences in place, unless you have read about it, you know what the condition is, how are you going to convince your patient that what you have said is not correct? And please listen to me. And so obviously you have to read up and be aware and be very listening to be able to convince a Google based or a doctor or somebody who says that please do this or please do that. So I think that is a very big challenge also for our therapists. And then, for example, the other thing within physical therapy, now, there will be some evidence, there will be a new machine, as you said. So vacuum electrodes, dry needling, halana, this and that and all. So there are two challenges here. Does the therapist himself know enough about this to be able to choose a modality, whether it's the right kind of exercise? Do you want to go with passive movements? Do you want to go with no exercise? Because I have had patients who come after 3 weeks of therapy somewhere else saying that mane be machine aapyu and I've got nothing else. No exercise, no looking at postures or whatever. So I think the evidence here is important for our private practitioners. Read small, but do read and see, are you being able to justify your choice of treatment, whatever it is? And so it's just not that you open a fancy clinic, you have some equipment and you want to use it. Are you justified in using it? I think that is where the research and the clinical practitioner has to have some kind of a tandem. And so these are, I feel, the challenges that the private practitioner starts with. And I always recommend that please think about what you are planning for a patient and what is the protocol, and whether you have been able to reassess in a few days, is it working, is it not working? So I think these are some of the challenges private practitioners would face, and they need to work on that. Thank you, Alpa.
Yes, ma'am. Truly said that we have to focus on evidence-based practice rather than Google-based practice to justify our patient. Thank you, ma'am. Now, my next question is to Dr. Nehal, sir. How can the physiotherapy shift towards preventive healthcare? Over to you, sir.
This is very, very interesting question for me, that because in my 27 years of practice, I always say patient कि प्रॉब्लम आए और ट्रीट करे वो तो ठीक है, लेकिन प्रॉब्लम आने ही ना दो. So I guess maybe in 2018 we have started. It was a kind of marketing strategy, but we have started fitness camp. So initially we were started with 20 people, and in those fitness camp, any age group people used to come, and we used to have all sorts of fitnesses as per their age group, and as per their age group we used to prescribe them certain exercise. Gradually it has become a kind of milestone event that we used to do those kind of fitness camp every 3 months. Now we are doing every monthly, and we are having more than 100 patients in that day. And along with that, now many other clinics are also joining, regarding they used to taste pathology tests and all those things are also being done to them. And this is the best thing what we are feeling, that the patient is repeating. He comes after 2 months or 3 months and he says that no, I am better. Whatever you have suggested, I am better with that those exercise. And he comes again for the screening. So that biomechanical screening, so that is a very good thing I feel, even for the layman, not only for the sports people or anybody else, but that has given us a good milestone and good excellent results. Along with that, gradually risk assessment are being taken, and this is what we felt that so instead of doing just treating that reactive treatment, we are planning to move towards preventive healthcare. So that is what I feel, normal simple sentence. And along with that, in that fitness test also we are also advising them as per their assessment, ergonomic analysis, gait analysis. We are always trying for whatever the normal basic things that he or she can do, other than any kind of using any sort of belts or orthosis or anything. So that is our first motto. And nowadays it is very much the word, right, like prehabilitation is gradually growing. Even many surgeons are saying that before surgery you just go and consult physio for a month or so. So it is called surgical prehab, so that surgical outcome also will be good. uh, Even in geriatric fall prevention, and we are teaching them how they should do in their age. ऐसा नहीं कि भाई मैं 75 को मैं cane use नहीं करूंगा तो नहीं करूंगा, not like that. If he comes in that assessment, then we have to say that you must use the stick or cane or anything like that. Then now technology is very much advanced, that our variables, biofeedback variables also we can give them. And definitely, the ma'am also earlier told that telehealth monitoring and all. So what we do, we are taking their follow-ups. कि भाई आपने क्या क्या किया, हमने आपको ये सब बोला था, तो whether you people have done it or not. Along with those fitness tests, that there should be lifestyle management, wellness coaching, and all sorts of things are. So now it is a allied and healthcare council. So I will look towards all those stuffs. So everything we can, mental health, metabolic health, and all the I mean, psychological and behavioral aspects also are being there. So this will give definitely. This is the this will give for the clinician or even academician, those who are involved with this economic shift. इसमें बहुत अच्छा आएगा as a earning purpose, and for even patients also it will be a good thing, because he is going to prevent his pain. So instead of coming for days or months to a clinic, अगर वो पहले से ही उसको बोलते भाई मेरी ये लाइफ है एंड व्हाट आई एम डूइंग, तो मुझे नहीं होना चाहिए, ये कुछ भी मुझे नहीं होना चाहिए फॉर फ्यूचर, तो दैट इज नॉर्मल सिंगल कंसल्टेशन वुड बी फार मोर बेटर देन लॉट ऑफ सेशंस ऑफ फिजियोथेरेपी. So this is we have to gradually, we have to uh, develop our society in a way that nahi, it should be कि भाई जैसे वो 6 महीने पे बॉडी चेकअप करवाते हैं, वैसे आपका फिटनेस असेसमेंट भी करवाइए आप. यू गो फॉर नॉर्मल physiotherapy assessment, normal fitness assessment, normal regular. So that will be a very good futuristic plan for even all the laymen also. That's it, I guess. That's okay.
Nicely explained that how we are usually doing that our health checkup regular base पर, तो उसी तरह से अगर हम हमारा फिटनेस चेकअप भी करवाए और पेशेंट को भी इतना चेकअप के लिए अवेयर करे, तो इट वुड बी मोर हेल्पफुल टू आवर प्रोफेशन. And also explain nicely about the preventive treatment rather than reactive treatment. Thank you, sir. So now my next question is to Dr. Bhavna ma'am. how can the research be translated into a student's clinical training? Over to you, ma'am.
Thank you for a very important question. I always say that treat the patient, document it, and publish it as a research rather than to do the research, treat the patient. तो हमारा कैसे होता है, हम लोग रिसर्च के लिए पेशेंट ट्रीट करते हैं. इन अदर कंट्रीज पेशेंट ट्रीट होते हैं इसलिए रिसर्च होता है. तो इट्स ऑलवेज अ डाउन वे बैक. जैसे कि वी एजुकेट द स्टूडेंट एंड गिव डिग्री rather than to give degree we educate them. So it is there is much more difference into both the concepts, and new generations should know the difference between both of them. Once the new generation is very well acquainted with the meaning of these two, then I think education would be up to the mark and research would be up to the mark in India. Now, if we talk about physiotherapy research, medical research is scanty, but if we talk about physiotherapy research, it's, I think, contributing only 1.5 percentage into the total research of Indian research. Because as I said, we don't document the intervention. We don't have a proper documentation into the clinical practice. Now, if we go to any of the educational institution who is associated with hospitals, there also there is lacking of the documentation. And when we go to the research institution, the documentation is really good, but they are not collaborated with the education. So here we need to integrate these three things: research, education, and clinic. That is a treatment. Then only we can transform research in education into research. So transformation of education into research needs this integration. Now, uh, publishing a simple case study, case scenarios, case series also would do or contribute into the research, but it should be done in a proper scientific way, documented well, re-evaluated, and an ideal as well as a true research has to be published. That is what is should be done everywhere, and which has not been practiced, unfortunately, but that has to be done. Now, how can you do that? So proper documentation is needed. And as we already, all the other experts have already discussed about, we every patient's treatment should include two components. One is quality of life and second is functional component. Both the components should be well documented pre, during, and post. Once you will treat the patient in this many formats, the research work or like the data would be by itself. We will derive the data from the details we have, and a research would be done. So, for as per my opinion, this if we integrate these three things into any of the clinical practice, not just the educational institution, but the clinical practice, as I said, the documentation. If it is been done properly, then research would be like research would be a parallel co-product of the clinical work. And I think Meeta ma'am, Nehal sir would agree to me, if they are into the clinical practice and they are publishing good researches with their practices, the documentation which is required is a regular practice into their setup. And that is why they are able to do it properly. Otherwise, retrospective data cannot be gained if the documentation is not proper. So if you want to transform the clinical data into research, then the data keeping is very important. And data keeping does not mean something documented on paper, something implemented properly, justified, and then just write it down or keep the data and then publish it. So every clinical practice should include mm, evaluation based clinical practice, and this evaluation based should have one component of quality of life and the functional component. As Sir said, the rehabilitation. This also would help us to get the rehabilitation data, whether we are rehabilitating them for the further complications or not. So I think the transformational physiotherapy practices from clinical practice to research only needs a small inputs from every clinician or every person who are involved is to just implement a few steps into the clinical practice, proper documentation and publish in a proper scientific way. Thank
Thank you, ma'am. You have given a very nice message to our students and audience as well, that a presented single case series is also one of the contribution in a research, but it should be well documented, properly follow up with proper evidence base. Thank you, ma'am. Now, my next question is to Dr. Suvarna, ma'am. So what are the key competencies for the modern physiotherapist? Over
Yes.
to you, ma'am.
Yeah, thank you so much, Dr. Alpa. And you emphasized on the word modern. So I would start with the AI that has come into the picture. And there is something called as information overload that is happening everywhere. So I think the first competency, whether it is a physiotherapist or a modern physiotherapist or any other person, is the ability to use the right information at the right place. I think that is something which every one of us needs to, develop this particular skill. So with the information overload, many a times students find it, very easy to use the information that they have to probably each and every patient. So they are not able to filter out what is important and what is not important for their patient. So I think the wisdom to use the right information at the right place is something which is very, very important from a point of view of the modern physiotherapist. The second thing that I feel is in this era of AI and a lot of machines, we are forgetting, or the students are probably forgetting, or the importance of the hands that they have. So as the previous speaker had said that, it is the tense which does not give the result. It is the person who is operating the tense probably who gives the results. So that is absolutely right. And we need to emphasize to the students that it is the hands, the clinical skills that are very, very important. So that is something which every modern physiotherapist needs to understand, that it is not the machine that is giving him the result, it is the hands that are giving him the results, and hence the clinical skills are very, very important. The third thing that is very important is the clinical reasoning, which the students are, forgetting nowadays. They rely so much on the patient, they rely so much on the machines, that machine will decide what program to give to the patient, that they are not able to rationalize as to which modality to be used at what particular time point, and when does the patient needs the exercises, how much the intensity of the exercises. Probably that is something which is, getting lagged. So I think the clinical reasoning along with the clinical skills is something which is very important for the students to understand. And the last but not the least is the key member of the rehabilitation team, which is the prevention. So prevention is the future of physiotherapy. With everybody being, so much of health conscious and health aware, I think the prevention of the diseases is something where the physiotherapist would have a major role in the coming time. And I think we should take the lead as a member of the rehabilitation team and focusing more on the prevention of the disease elements and improving the health of the individuals. Thank you so much.
Thank you, ma'am, for nicely explaining the importance of clinical skill. As we know, the machines are always made by man only. So we have to use a rational protocol or rational dosage to treat our patient. So thank you, ma'am. So my next question is to Megha, ma'am. So what is the role of AI in the physiotherapy research and guidance for impactful research for clinical decision making? Over.
Am I audible? Yes. So very rightly said, we've been talking of evidence-based practice and clinical decision making. Evidence-based practice is for clinicians. It is done by researchers, but for the clinicians. So clinicians need to start using EBP into CDM, which is evidence-based practice into clinical decision making. And both have the same pillars. One is good evidence. The other is the clinician's experience. It is not only whether this evidence works or doesn't work, but it is what is the quality of that evidence and what is my experience as a therapist that enables me to use that evidence into my practice. Like Suvarna ma'am said, AI is definitely coming. How do I use artificial intelligence along with my human intelligence to help me into best practice? Yes. So how to make research impactful is the answer is actually very simple. I get publications into high impact journals, which is Scopus Indexed and Web of Science. It is easier said than done. It's almost impossible to get publications into Scopus Indexed and Web of Science journals. But we can also see the levels of Scopus Index. You have Q1, Q2, Q3, Q4. You can start with Q4 journals. And like Bhavna ma'am said, it is important to document and publish. It is not only enough to do research, but it is important to publish them. So whatever you do, it has to be published, whether the results are positive or negative. Now, AI is an important tool helping you into this publication. It will help you right from the beginning to the end. So deciding the question which is important, like I said earlier, we need to do research on clinically important or socially important questions. So AI can help us find that, but we need to work along with AI. AI is a great tool, but it cannot replace ourselves. So even that Dhara ma'am and Suvarna ma'am said, okay, our intelligence stays where it is. AI can help make us better, but using AI effectively, using the right prompts and using the information that we get is all depending on us. AI can help right from searching the problem, developing the methodology, writing the paper, even searching for the journal that is correct for you. It helps in the referencing. So AI is now an almost inseparable part of our lives. But like my father used to tell me, common sense is not very common these days. Artificial intelligence cannot replace human intelligence. Please keep your intelligence in place and use AI along with whatever you have with you. Your hand, your brain cannot be replaced by whatever technology comes in. Yeah. So that's all.
Thank you, ma'am. You have shown nicely how to use all the information during our research or during our clinical practice, but we have to use the information wisely to get a best result.
Yes.
Thank you, ma'am.
Yes.
So my
Thank
next question is to Dhara ma'am. What is the role of IAP in translating research into a practice? To you, ma'am.
Yeah, thank you once again. So research is something that, especially if I talk about last few years since the new IAP has come into effect, they have given quite a lot of emphasis and importance to the research, to the extent that we have a separate research wing from IAP in itself, and they are beautifully conducting a lot of awareness session as well as encouraging the researchers, even providing them some sort of funding. So that is one part of it. Other part is also where they are generating these evidences in the form of clinical practice guidelines. So far, right, it began from the COVID, then it went into geriatric and then women's health and then eventually stroke. So there are clinical guidelines which are being published and they are generated for the practitioners to use. So IAP is definitely performing its part, but then the generation is going on. What about the dissemination part of it, and what about implementation part of it? So when it comes to dissemination of these evidences, it is again, I would say, the responsibility of obviously IAP office bearers are doing their bit here and there, and also IAP digital media team is displaying all of these information on the IAP website as well as on the social media platforms about these clinical practice guidelines. But beyond that, all the institutions, again academic institutions as well as clinicians, once they are made aware about these clinical practice guidelines, they need to adapt it. Now, what I mean by adapting it is not just by purchasing those books and keeping it in the library, but rather institutions will have to actively getting involved into dissemination of it as well. Few of the suggestions to the institutions, what they can do is, they are regularly anyways conducting these community camps. They can make their students aware about it, they can make their patients aware about it, and they can also publish this information on their social media platforms. The beautiful part of some of the guidelines that we have, which are issued by IAP, is that they are written in such simple language and are also meant for the layman to use. So, people sitting in Saurashtra or Baroda need to know that the condition that they are suffering from, the evidence based physiotherapy exists and it is accessible to them. And that's where the true translation of these evidences would happen into the practice. Thank you.
Sorry,
Thank
one
you, ma'am.
addition to that. Sorry.
Yes.
We also have clinicians who have participated in writing these CPGs. So it's not only the academicians who are doing it, but it's a collaborative work of.
Absolutely, ma'am. What I meant was the academicians have
Yes.
the responsibility to disseminate it.
Yeah, that agreed, but just sort of putting in the clinicians part.
Yes, absolutely.
Thank you, ma'am. Dhara ma'am, for nicely explain about how the IAP is translating the research, like different journal, CPG guidelines, seminar, and research funding also. So thank you, ma'am, for this information. So my last question is to Dr. Meeta, ma'am. Can you elaborate the importance of balancing experience with evolving research?
Okay,
Over to
thank
you, ma'am.
So I was listening to all the interesting comments. So I just wanted to show you, even in a private clinic, a small clinic, I have a documentation paper. So every patient who enters my clinic, at least, we document and my team documents. It's not as extensive a documentation as the college would do for a student or for a presentation, but we still have documentation so that at the end of it, what was your patient and did you achieve something. So I think that is a very good thing. Coming back to Dr. Alpa's question on balancing experience, see, the first point, I have 2-3 things just I wanted to say quickly. One is that young therapists who just pass out, they have spent money to educate themselves, and also first thing they are looking at is how do we start making money. So I feel that one of the thing is that please try and join an institution or a private practice where you continue to learn some clinical skills after your college and your studies. Like, you may be an MPT, you think you know everything, but honestly, when you come and you really see a patient in the community or in the private practice, it is not the same at all. So I feel that I would encourage everybody. I myself are in practice since 40 years, and 37, 38 years I'm attached to a hospital where we do education as well as research, and I run a private clinic. Okay, so I don't want to leave that even at this stage, because that is my method of getting growth. Because I'm in an institution where we are interacting, we have case presentations, we have so much research going on, that my growth, otherwise 20 years back I could have said I'm 20 years in practice, I know everything, I will just stagnate. So to prevent stagnation, I feel young therapists must join clinical practices where they can learn and grow and see patients before they open their own clinics. That is one message. The other thing is that how are you going to balance your experience with evidence? Which is today's topic. So, for example, 10 years or 12 years back, I attended this seminar on blood flow restriction therapy. I'm just giving an example. I came back, I read all the evidences and everything. Now, when you are applying that technique, for example, so there is a patient with quadriceps weakness, say in a young, sporty, post-operative ACL repair patient, I may choose blood flow restriction, BFRT. But in a 60-year-old patient with knee pain and quadriceps weakness, would I want to use that? No, because there are so many other factors over there. They may have blood flow problems, circulatory problems. They may have hypertension. They may have stress and so on. So I think experience comes there when you have a modality at hand, but do you want to use it or not? And is it the right thing? So you have to read about it. You have to build up your own quality of your what you are doing, and then how do you apply it? That is where things. And for example, the other point I wanted to make was when especially even our fresh PGs, for example postgraduates, when the institutions are training, because I see Bhavna ma'am is there, Megha ma'am is there, so a lot of educationists. So when you come out now, a simple example of say a child with cerebral palsy dealing with spasticity, in my clinic, in my hospital OPD, I find they love to give stretching. Now, first of all, you have no rapport with that child. Stretching, when you are giving an open chain stretching, can be so painful for the child. And so are you doing it correctly? They will hold their holds. They're holding at the mid-foot level to give a full hamstring, say, stretch or a TC stretch for the child. You will cause a mid-tarsal break over there. So even your holds and your handling skills and all are not there when a person, even though they may be a master's or a new practitioner or whatever. So I think that is where experience counts and helps the challenge. You have to have a balance. Please come and learn first what you have studied. Yes, your research evidences must be very good, and I would want to learn from you as well. But please, can you first just learn to handle a patient, or just learn to talk to a patient? And even Dr. Nehal said that just learn to look at them holistically, talk to them. So I think experience and research is always going to go together. There cannot be a either or. It has to be synchronous, right? Thank you so much.
Yes, ma'am. With a very good example, you have explained how we have to balance the clinical scenario as well as evidence-based practice. So at the end, each and every panelist has been shared their valuable knowledge and inputs about this topic. So let me summarize 2-3 key points. So we have to make our practice on a rotation base so that we can get a learn a new techniques as well as new skills. So continuously upgrade our knowledge. Work is always in a process. Nobody is perfect. So rather than focus on statistical significant level, we have to focus on clinical significant level and choose the right evidence-based practice rather than only Chat GPT as well as Google GPT. So focus on preventive rather than reactive treatment. Research should be well documented, properly follow up, and with evidence-based. And we have to learn a clinically hands-on skill, which is very important for all the academician as well as clinician. So keep yourself update with the new technology. So thank you so much once again. At the end, I would like to thank our respected panelists for your valuable time and inputs in the topic translation physiotherapy, connecting classroom, clinics, and community. So I would like to thank Dr. Nehal Shah sir, Dr. Meeta ma'am, Dr. Bhavna ma'am, Dr. Megha ma'am, Dr. Suvarna ma'am, and Dr. Zara Sharma ma'am.
Thank you.
Any questions from the audience side?
Thank you, Dr. IAP Women's Cell and Ruchi Madam for providing us this platform to share our thoughts. because this is very important to discuss it with the new generation, how we think as a senior but old school they feel, but it is very important why these old school thoughts are being implemented, should be implemented. Thank you.
Yes, ma'am. Very true, ma'am.
Thank you so much,
Yes,
Dr.
Neeta.
Bharta, for inviting me, and very good insights from all the panelists, and learned a lot through this panel discussion myself also. So it was a great having you here, having me here at this panel discussion, and I give best wishes to IPWC Gujarat for rest of the conference. Thank you.
Thank you, ma'am.
Thank you so much. Thank you, everybody.
Thank you, ma'am.
Thank you. Thank you.
One
So we are
very
yes,
good
ma'am.
time listening to all the panelists, lot of learnings, and wonderful moderation by Alpa ma'am. Thank you, IAPWC Gujarat, and also IAP and IAPWC at the national level. Thank you.
I must mention Jaspreet ma'am, who is not, we are missing her here, but she must be there in some other panel. But
Yes.
we really appreciate her efforts to make this conference very successful.
And I also want to say hello, special hello to Dr. Neeta Vyas, who I see there. And yeah, it's nice to have her on the panel too. So thank you. Hi, Neeta.
Hi, Meeta. Nice to see you.
Correct. See you. Okay, bye,
We
everybody.
were batchmates and roommates when we were studying.
Correct.
And બધાને hi, hello, good afternoon.
Good
સારું
afternoon.
panel
Hello.
હતું. Discussion સારું કર્યું. Before starting our new curriculum, I think people will come to know what changes are coming up.
Yes,
Correct.
definitely, ma'am.
So thank you all panelists.
Thank you.
Thank you
Thank
all
you. Thank you, ma'am.
panelists. Thank you all participants
Thank you,
also.
Alpa ma'am. Thank you,
Thank you, ma'am.
IAPWC.
Yeah. Thank
Thank
So
you.
we are closing this panel with a very good message, and now we will implement during our practice also. Thank you once again.
Thank you.
Next session will start at 2 o'clock.
બોલીએ હાલો બી.